Before we start, check out my brand new 40-120 transformation program, the ultimate fitness coaching program for men over 40. Click the link in the description to learn more about it. All right, Doc, what do we need to know about Ozempic?
Well, what we need to know about it first, it's semaglutide, as known as Ozempic, which is the most sold drug here in Canada and America, in North America, let's say. And it's a medication that is prescribed for diabetes people. Okay, it's just type 2 to help diabetes people regulate their blood sugar and also, as a side effect, lose weight when it's coupled to lifestyle changes.
Right.
Let's say a better diet and also exercise. People from the study, people who were on Ozempic lost up to 20% of their weight.
Okay.
Well, those people were followed.
This is with a nutrition plan and exercise.
Exactly.
Okay,
And
it's not just a pill.
exercise.
Okay.
Okay. So when you get an Ozempic, most people don't know what is it. It's also an injection. Ozempic is the injectable. Okay.
Okay.
We have another one that the company sells now. It's the Rybelsus. It's the same thing, but it's a pill. Okay.
Okay, so you have the choice between a pill or a
Well,
injection.
for diabetes.
Okay.
For diabetes,
Okay.
you have the choice of taking either of them. But now people used to take Saxenda before to lose weight. Okay, Saxenda is the same kind of drug as Ozempic.
Okay.
They are called GLP-1. Okay, so what do they do? They make you feel full very early. So, and they decrease your stomach emptying. That's it.
That's all it does.
That's how it works. And from that, you will get nausea. Some people get vomiting. Some people might even get
Constipation, I heard that for sure.
pancreatitis. So when you are on this drug, your doctor need to follow you up to make sure that you don't develop any of these symptoms. The most common one is weight loss.
Okay.
Okay. And also the nausea. Vomiting, if you start vomiting, they might decrease your dose. But we need to make sure that people know the contraindications.
Okay.
It's first of all, it's a history of pancreatitis, history of pancreatic cancer, and also thyroid cancer.
Okay.
There is a specific type of thyroid cancer. So, and men too, a syndrome. It's multi-endocrine neoplasia type 2. So,
Okay.
all of these, if you want the definitions, you need to speak to your professional. He or she will tell you more about that
How did it become a weight loss
medication.
medication? Yeah.
Because people were on Victoza. Okay, well, not Victoza, Saxenda.
Okay.
Saxenda is a daily drug that you have to inject yourself every day. And it was covered by insurances, okay, for weight loss.
Okay.
It's a bigger dose. But with Ozempic, it's a once weekly medication. So most people traveled from Saxenda to Ozempic just for, less injections.
So if you're doing it, so I have a question because I'm a little bit confused. It's a medication for diabetes.
Yes, sir.
But I know clients who are not diabetic that are getting it for weight loss.
Yes, because of the metabolic syndrome.
Okay.
Metabolic syndrome is what you know as central obesity. So
Okay.
people will use that to decrease their visceral fat.
Yes.
The type of fat that you cannot decrease by exercising. The type of fat that makes you sick. So exercising do not decrease that type of fat. But dieting does.
Okay.
So if you couple the medication, as I said, with a diet that helps you with all that. So Ozempic is also known to prevent and protect from cardiovascular diseases sometimes.
Okay.
Yes, and it also decreases blood pressure, your cholesterol. All of that is secondary to visceral fat decreasing. That's it. Period. And how much does it cost?
How much does it cost?
Let's talk about it's $280 up to $300. It's
A
the
month.
price
A month.
range. Yes.
And this is covered or not covered?
It's covered if you're diabetic. If you're not, it's not covered.
Okay.
Yeah.
And that's the price, 300.
Yeah. That's the
Okay.
average price. So I used to take this medication.
You took it.
Yeah, I took it. As a diabetic patient,
Okay.
I took it. I've lost weight with it, but it didn't work in the end for me because I was just having all the side effects
Okay.
with no effect
Oh.
itself. Yeah, because why? I didn't have any energy. I couldn't eat. I was nauseous AF, and my friend, I decided to stop it. And now I'm taking a new drug. I'm on a very low dose, and I'm fine and losing weight, having much more energy. So people need to understand also when you take Ozempic, you don't lose only your fat, you lose muscle too, because you are not eating anything. You can't eat nothing with Ozempic. You're nauseous. I call it pregnancy in a box.
That's it.
Yeah. It's
So basically, that's what it does. It cuts your appetite.
cuts your appetite from the get go.
Like I said, I heard people I had a few clients who were on it and they were very constipated. Some were nauseous. Some it
Well,
varied. And one
it
person.
slows your intestines. So what did they expect? You will be constipated.
So that's the overall process of
That's how it
slows your
works.
intestine. You eat less. You go to the bathroom less. I'm assuming.
Exactly. And when you go, it's very hard. Because what you need to know about poop, the more it stays in, the more water comes out of it. So it will be harder.
What do you do when you meet a patient? How do you decide if you're going to put them on Ozempic or not?
Well, we have many things that we can do. Let's say that I meet you. You are a diabetic patient with a BMI of 32, okay? Already on metformin and another medication, a sulfonylurea, that is not working properly. You are gaining weight. I will add Ozempic. That's what I will do. Now, from Diabetes Canada, they say that GLP-1s, Ozempic, Victoza, Saxenda, tirzepatide, Mounjaro are supposed to be part of the first line medication with metformin that you
Okay.
should start for a patient who is diagnosed with diabetes type 2.
Okay.
So-
Only type 2.
Type 2. So people, when I do that, I make sure that you will lose part of your A1C, which is it's called hemoglobin 1C, hemoglobin A1C. So we call it A1C, which is the hemoglobin that got linked to glucose because there is too much of it circulating. So that's the reason why. And when we have that, it gives us an idea of your glucose over 3 months.
Okay.
That level goes down 1% or 1.5% when you are taking GLP-1,
Okay.
when you take it properly at the proper dose. So the threshold goes lower. So people need to understand under 7 is considered controlled. Okay, if your A1C as a diabetes patient is under 7, is considered controlled, not optimal. If it's optimal, it's under the diagnosis range, under 6.5.
Okay.
It's called optimal. So with Ozempic, we achieve that. And also weight loss comes with it.
Mm.
That's the beauty of it. If you're not diabetic, we also have, some specific criteria that we can use.
Yes.
So we
So,
will,
so sometimes if they're not diabetic,
yes,
but they're overweight,
you come for weight loss.
okay.
I will, let's say you want a weight loss drug. We need to make sure that you didn't have any of the contraindications, making sure that you're not pregnant
Okay.
or not lactating.
Okay.
Black box warning. Okay. And also no history of pancreatitis, pancreatic cancer, thyroid cancer. Make sure of that.
Why? Because it could trigger something?
It triggers them.
Okay.
So, yeah. So when we do that, you need to have a BMI over 30. Okay. And another problem. Okay. Let's say hypertension. Okay. Under 30 with a problem or over 30. Those are the criteria that we use. I had many, many patients with a BMI of 25 who comes for Ozempic. And I literally tell them, well, I don't think it's a good drug for you. I don't recommend that for you. I would prefer you exercise or do this and that. They usually come out not happy because they thought that I would give them Ozempic freely. So this is the problem that caused the shortage of this
I heard
drug.
about that.
Many of us, like doctors, are giving Ozempic to every single person that present themselves in our clinic.
I'm going to ask you a silly question. I know I'm cutting you off. Why do they do that?
Well,
there's no commission or anything they get from that? Okay.
No. Well, a person comes in, okay, and you are in a weight loss clinic. The person comes to you, doctor, I want to lose weight. Okay, so let's start by changing your lifestyle habits. Let's start, a diet, making sure that you don't have a problem with eating, eating disorder.
Eating disorder, something else. Yeah.
We need to make sure about that. And, well, making sure that you don't eat because you're anxious. You don't eat your emotion and stuff like this. And they usually tell you, doc, I want Ozempic from the get-go. I don't want anything else. I just want Ozempic.
So like everybody knows about it. So
They know what they want.
Everybody knows what it is.
They know what they want, but they don't know what it does to them. I ask them usually, what do you know about Ozempic? What makes you interested in taking Ozempic? They used to tell me, I have my friend who lost 10 pounds over 6 weeks, okay, and is on Ozempic. Okay, fine. So how does that apply to you? How does that apply to your case? How much do you weigh? How about your lifestyle? How much do you eat? Do you eat before you go to sleep?
That's what I do. We had Simone. They lost enough weight without it. Some people just want a quick fix. That's why.
Only one thing: making sure that you sleep 3 hours after eating. That's changed a lot in one's life.
Yeah.
So, and when they come to you, doc, I want this and that, and I would tell them, well, I don't think your BMI is 28 and you don't have any medical problem with that, so you are not at risk. Well, they will insist on having it. Some doctors, will
do it.
Did that.
But technically, you're not supposed to.
You're not supposed to. We have guidelines for that. So, yep, myself, I don't do that. I will tell you. Basically, I don't recommend this medication for you. And I will need to let them know when you lose weight on Ozempic, when you stop it, it comes back.
That's what I was going to ask you.
Right back. Because it just caught it.
So it cuts it. So once you stop it,
Oh, it comes back.
If you don't follow your lifestyle exercise,
Exactly.
because my clients who are on it, they're all training, they're eating well.
Exactly.
And I mean, I've seen the results. Like,
They need to keep the same habits they were on as they were on Ozempic.
if they're not, they're going to gain the weight.
Oh yeah, yeah, yeah.
Is it going
If you
to,
stop it,
are you going to
wait.
gain it all back and more? Or all like, how does
all back and more.
all
Of
back and more?
course. Of course. I had patients who took Ozempic, lost 12, 20 weight, 20, 20 pounds of weight,
Yeah.
and they stopped it. Cold turkey,
And
right back.
right back.
20, boom, like this, sir. So it's interesting how people think a quick fix
Yeah.
can deal with everything in their life.
But what's the commitment? Like when you put somebody on Ozempic, you say you're on it for 3
For
months, 6
life.
months, a year, for life.
For
Well, if you're
life.
if you're diabetic, I could.
If you're diabetic,
then I
yes.
get it. If you're not diabetic, you're like,
It's
I
a
want it for weight
medication
loss.
that you take for life. People don't understand that. I will take Ozempic for 3 months because I will get married in 3 months. I need to fit, in my wedding dress.
Yeah.
And what happens after?
You gain it all back. Wow.
I've had that. That was a specific patient of mine who told that to me. And I didn't give it to her.
For a wedding day, you would have been like, no.
No.
No, but I
Just
agree.
for
Does
3
it-
months, no.
I agree. It doesn't make
Sorry.
sense because it's still like what like. So other than those, do we know if there's a long term?
Long-term effect. Ozempic is a new drug, okay?
How
Long-term
many years has
effect.
it been out in the market? Because
Oh.
it's only heard about it like last year. Everybody spoke to me about it.
It's
I,
been more
like,
than 4 years, if I'm not
Wow.
mistaken. Yes, it's more than 4 years. But people, I'm sorry, but Ozempic is a medication that does a lot for a diabetic patient.
yeah.
Okay, if you're not diabetic, of course it makes you lose weight. Of course it helps you. It decreases your lipids because you are not eating. Okay,
So it's like you're fasting in a way.
exactly. It's
Like,
fasting.
So I'm on
It's
Ozempic.
fasting.
I'm on natural Ozempic with intermittent fasting.
Guilty.
I guess it's
So that's they need to understand that you cannot eat nothing. You cannot. You don't basically eat, and energy. You don't eat. You have no energy. Hypoglycemia. People experience that a lot with Ozempic, but Ozempic is not known to cause hypoglycemia because it was studied on diabetic people who had a very high glucose level.
good point.
You're not diabetic and you're taking it. Hypoglycemia. Yes, welcome.
Good point.
So, also, you will lose weight and you will cap at a point in time, but the dosage can go up to 2.4. That's the dosage of Wegovy because Ozempic is not the brand for weight loss. Wegovy is.
Oh, I didn't know that.
It's semaglutide with a bigger dose. It's a bigger pen. Okay, you will take that once a week. And it's the same thing with Saxenda. Victoza is the same kind of drug, it's the same drug, but Saxenda is the brand for losing weight.
Okay.
And with the shortage, the other company even found a way to make it available as a pill. So they have a pill now that people need to take very early on an empty stomach, okay? And you need to wait 30 minutes before you eat. So it's not for everybody.
Yeah.
Some people might take it, and some of them will tell you, well, I want my Ozempic, thank you. Have a nice day. Period. Because you can take your Ozempic on the go.
Well, I don't know. I think
Eighth.
their marketing has been pretty tight because everybody's heard of it. Everybody knows it. Like, I mean,
Yes.
and it seems like people tell each other to.
I've seen this on the 15. We have that. There is a billboard just with the name Ozempic.
Ozempic. Wow.
Ozempic, tell your doctor about it.
Like,
You will come to me, doctor, do you know about Ozempic? I'll say, yes, I know. What do you want to know about it? Okay, I will ask you questions. I always want my patients to be, to be informed properly. How to take Ozempic, okay? How to start Ozempic, okay? The dosage you need to start low, go slow.
But I guess that your doctor decides what dosage. He's not just gonna.
Of course, there is a dosage that you need to start on. I will not start you on 2. I will start you on 0.25.
I have my client. He's going up to 2, and he's having a hard time with it.
Oh, if he's having a hard time,
Yeah.
he should stop.
Yeah.
He should keep the dosage and change his life habits. That's it.
Does it affect your sleep?
If you're hungry, you won't
Yeah,
sleep.
you won't sleep.
And with Ozempic, there is that thing. I experience that every single night. At 11 p.m., oh, I'm hungry.
It's true because then
I was hungry because I didn't eat nothing for the whole day. And at 11 p.m., I wanted to go to sleep, but impossible.
How many meals would you have with Ozempic a day? Like, how many calories did you ever calculate to like?
I've never calculated that, but I think it's under 1,000. It's under 1,000
Wow.
per day. Yeah, it's very restrictive. People with some eating disorders will come for Ozempic. Yes. Bulimia nervosa, people who eat because they feel sad also. And after eating, they feel bad about it and they vomit. And they'll go back and eat again.
Brilliant.
So, or also people with bulimia secondary to anxiety.
Right.
Okay. So they will eat because it makes you feel good. It's like a drug.
It's like a drug. Yeah.
Yeah. So
Food is an addiction, like anything else, right? If you take
Yes,
it
sir.
for like,
and the more the greasier it is, the more addictive it is.
yeah.
So you need to think about that before going to get a hamburger.
So I think if you're on Ozempic, I think what I'm getting is that obviously see your doctor. Make sure that
Yes,
that you're,
make
you're
sure
taking
take a
it for the
blood
right
test.
thing.
Take a blood test. Okay. First of all, take a blood test. Make sure that your health is okay. Speak to your doctor. Discuss about the side effects and tell him or her what you're going through. He might be able to help you. He might tell you, well, let's decrease the dose, okay? Let's adjust it. Let's personalize your medication for you because you are not a number. You are a person. So if you're taking a medication that is not working for you, you should go back and see your professional and discuss.
And is your doctor going to tell you, okay, I'll give you Ozempic, but you got to go see a trainer. You got to go see a
Never.
nutritionist.
Well, I said never, but not necessarily.
Yes.
I will
You
take
you
that
do it, yeah.
right away because I tell them you are on Ozempic, but Ozempic will not fix your life. Okay, you will have to take decisions there. You will have to decide not to eat pizza 5 times a week.
Yeah.
Okay, that's one of the reason why. Okay, you will need to eat more veggies. You will need to eat your fruits. You will need to make sure that you have enough vitamins in this body of yours. because
Especially if
when
you're not eating a lot.
you are not
Whatever
eating
you're
a
taking
lot,
in better be good.
it's supposed to be. So, yep.
And then exercise. And I think
Of course, at least I tell all my patients, at least 30 minutes of walking a day,
Yes.
5 days a week
Yes.
is a recommendation.
Yes.
30 minutes only. I don't tell you, start doing 30 minutes tomorrow. Let's start by doing 10 minutes tomorrow. Okay, just instead of taking the elevator, just take the stairs.
Absolutely. Yeah.
That's a change.
It adds up. All those
of course,
those
sir.
calories you burn doing
Yep.
the stairs, walking, doing the little things, you're in the shopping mall, like you said, take the stairs.
Exactly. If you want to lose weight, you need to be on a calorie deficit
Yeah.
diet. Okay, period. That's it. That's the
Simple in. Calories in, calories out. That's it. It's
Period.
a count. Once
It's a
you
count.
once you figure that out, you're good.
and what people need to understand too, your hormones can make you gain weight.
Absolutely.
So it depends. Men gaining weight after 40, after 30, okay? Women getting weight after menopause. So
But
all
with
of
a blood
these,
test, you can see all that.
oh yeah.
Yeah. Okay.
Just a blood test. Well, blood test doesn't necessarily seize it. Okay, you go see your doctor and talk about your symptoms.
Okay.
Your doctor is supposed to treat your symptoms, not a blood test.
Okay.
A lot of professionals do that. They treat a blood test, not a patient. Myself, I treat a patient, not a
Okay.
blood test. I don't treat a level. I treat my patient as an off-label use for hormones, let's say.
Okay.
If it's hormones, it's a off-label use. Okay. I'm not telling everyone that every man should be on TRT. That's not what I'm saying here. I'm saying if you have a problem, okay, if you're having symptoms, you need to discuss with your doctor, and you will to take decision with your doctor on that.
Perfect. So, guys, I hope you enjoyed this episode. Dr. JBR, thank you so much for clearing that up. I learned a lot today. Hope you guys enjoyed this episode. Make sure to leave us a comment. Make sure to subscribe, hit the bell, and follow the doc, JBR. I'll put his link right in the comment box.
All right. Goodbye, guys.